So look at a very common orthopedic issue, that anytime you go to an orthopedic ward of a general hospital, you should always see hip dislocation issues there. Okay, hip dislocation issues are very, very common. Okay, they occur so frequent due to accidents, due to missing your steps and all of that. So hip dislocation, just so you know, it's a serious injury where the head of the femur, that's the thigh bone, is forced out of its socket. Okay, so normally it should be here and it should be peaceful, but once it is trying to come out, depending on the, so dysplasia is just small, subluxation is just small, while dislocation is totally out. Do you understand the differences? So it's a medical emergency because it can damage the blood vessels there, and the blood supply could be what disrupted, leading to ischemia, okay, and necrosis. So types of hip dislocation, we have the posterior dislocation, which is backward, is the most common, 90%. So the femoral head pushes backward out of the socket. It often occurs in car accidents where the knee hits the dashboard, you know. Anterior dislocation goes outside, okay, goes forward, right, caused by falls, by sports injuries, and the rest of it. So causes, general causes: high energy traumas, car accidents, you are falling from a high place, sports injuries, you know, football, American sports, all those crickets, you know, the congenital or developmental. So some people are just born with it. Okay, so symptoms: there's severe hip pain, there's inability to move the leg, so the leg appears shortened or rotated, so possible numbness or weakness if the sciatic nerve is now injured. We diagnose it with clinical examination, abnormal leg positioning, pain, and immobility. X-ray confirms dislocation and rules out the fractures. CT scans and MRI scans can also help you diagnose. So management: emergency reduction, so all those closed reduction, open reduction, immobilization, rehabilitation, you know. Then complications to manage is to monitor. You don't want avascular necrosis, that's total loss of blood supply to the femoral head, leading to some death of tissue, so you don't want that. The post-traumatic arthritis, then recurrent instability, you are managing all of that because you don't want any of them to come up.